everyone, welcome back to our Let's Learn About It playlist. Thank you for watching this video, and please keep in mind that this video is the second part of our previous topic, COVID-19. So if you haven't watched part 1, visit International Institute YouTube page. Today, we're going to be talking more about coronavirus, particularly what to do if a doctor says you should quarantine. Then, we're going to give you some tips for staying safe if you're living in a large family, especially with high-risk family members. And finally, some tips to keep you safe. But first, let's start with a recap to see how much you remember from the last video. Last week, we talked about a variety of things, including dispelling rumors and myths about the disease. We gave you up-to-date information on the illness, such as the symptoms, and some tips to keep you safe, such as wearing a mask and social distancing. We also reviewed how to monitor your symptoms daily and how to get help. Let's see how much you remember. I'm going to put some questions on the screen, wait a few seconds, and you challenge yourself by pausing the video and answering the questions in your mind. So my first question is, what are the common symptoms? If you remember from the previous video, the common symptoms of COVID-19 included fever, cough, shortness of breath, difficulty breathing, fatigue, change in or loss of taste or smell, muscle aches, headaches, and vomiting or diarrhea. Next question. How can we protect ourselves and others? There are many ways that you can protect yourself and other people. First and foremost is wearing a mask. Second, remember to wash your hands frequently and properly. And when I say properly, that means it should last at least 20 seconds with soap and water. And if you do not have access to soap and water, use a hand sanitizer that has at least 60% alcohol. And finally, remember to social distance, which means 6 feet or 2 meters distance between yourself and others. Next question, can children get the coronavirus? Unfortunately, yes, they can. Can you have coronavirus if you do not have any symptoms? Again, unfortunately, yes. You can also spread the coronavirus to others even if you don't know you're sick. How is coronavirus spread from person to person? Coronavirus can be spread through your breath or respiratory droplets. That's why we recommend you to wear a mask and social distance. And the last question, what should you do if you are starting to have COVID-19 symptoms? That's correct. You need to call your doctor and get tested. If you don't know how to do this, call your caseworker. Now, let's get started with some new information. After you call your doctor, you may be told to isolate or quarantine. What does that mean? There are a few situations where a doctor might give this advice. First, if you've come into contact or been exposed to someone who has COVID-19, the doctor will ask you to quarantine. Being exposed to someone who has COVID-19 means that you were first less than 6 feet away from them and spent more than 15 minutes time. You will need to quarantine for 14 days from the last day you were in contact with that individual to wait to see if you develop any symptoms. If you already have had COVID-19 in the past 3 months and recovered, and you are exposed again, you may not need to be quarantined. Ask your doctor for more clarification if you feel this applies to you. Second situation is if you tested positive for COVID-19 and have no symptoms. The doctor will ask you to isolate for 10 days. If you tested positive for COVID-19 and do have symptoms, your doctor might recommend isolating for a longer period. Typically, if you have symptoms, you can return 10 days after symptoms first appeared and have been without fever for 24 hours and your COVID-19 symptoms are improving. If you're having a poor immune system or had severe symptoms, you may need to stay home up to 20 days or more. Always follow your doctor's guidance. The third situation is if your doctor recommends you to get tested to see if you have COVID-19, you'll need to stay home until you get the results of the test. If you get a negative result, meaning you do not have the coronavirus in your body, you no longer need to isolate. If you get a positive result, you'll need to follow your doctor's guidance, as we just talked about it. Now we want to see what you should do if you're told to isolate. This means that you need to stay at home. You are not allowed to go outside, go to work, go to the grocery stores, or any other place. If it's possible for you, stay in a separate bedroom from the rest of the family. Avoid going into common shared spaces of the home, such as the living room or kitchen. If you're sharing your home, you will need to ask someone for help to bring food to your room. If you live alone, this means asking for help getting groceries delivered to your home. Be sure to sanitize the surfaces that you touch after using the bathroom. This includes door handles, faucets, and any other items. Regularly sanitize frequently touched spaces throughout the home as well. This means cleaning with disinfect cleaners. We'll talk about more types of isolating in a little bit. In this slide, we're going to give you some guidance if you live in large families. First of all, if your family has anyone who is high risk, then all family members in the house should consider themselves high risk too. Remember, high risk can mean an elderly person or someone with an underlying health condition such as diabetes, cancer, or heart disease. First of all, don't leave the house unless it's absolutely necessary, for example, for work. Second, don't touch your eyes, mouth, nose with unwashed hands. These are the places that coronavirus can enter your body. 3. Cover your cough or sneeze in the crook of your elbow or with a tissue and then promptly throw the tissue away and wash your hands. 4. Wash your hands frequently. Use hand sanitizer if soap and water is not available. 5. Clean and disinfect your home. Wear a disposable glove if available, and clean frequently touched surfaces daily with soap and water or other detergents. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. Then, use a disinfectant that is appropriate for the surface. Disinfectants are chemicals that kill germs on surfaces. Ensure that children cannot eat or drink the chemicals. And finally, guests should be avoided unless they have a strong reason to be there. For example, a visiting nurse. Having people drop off items is okay, but avoid having anyone in the home for longer than 15 minutes. If they do come inside your home, have them wear a mask and stay 6 feet or 2 meters away from others. Here are some tips and recommendations if you live in a large family and have a high-risk family member. Some of these tips are similar to the general guidance for everyone. You will see some repetition here. However, a few that are different that we'll focus on include avoiding social gatherings of any size, avoiding public transportation or riding with people from outside your family, and wash your hands right away when you get back to home. Keep away from your high-risk family members. Even though St. Louis has okayed gatherings of less than 50 people, if you live with someone who is high risk, don't attend any social gathering. Avoiding sharing a car or riding public transportation can be hard. Many people don't have a lot of options. If you have to ride public transportation, don't touch anything. Stay away from others, wear a mask, and bring a small bottle of hand sanitizer with yourself. Be extra vigilant about not touching your face with unsanitized hands. If riding in a car, follow the same rules as for public transportation, and try to have the windows open to increase airflow. Wash your hands straight away when coming home. It might be useful to change your clothes when coming home as well. Keeping away from your high-risk family members means staying 6 feet or 2 meters apart. Avoid hugging, kissing, or sharing food or drinks. It is very important to teach children how to stay safe. Teach children in your family the same things that everyone should do to stay healthy. Children can spread the virus even if they don't know it, and even if they don't show any symptoms. Try to make it fun. Make up some songs about wearing a mask. Sing a song for the 20 seconds it takes to wash hands. Reward kids for frequent hand washing and avoiding touching their face or picking their nose. Play dates should be avoided, but it's important that they stay connected to their friends, even if it's remotely. Practice what 6 feet or 2 meters away looks like, so they get used to understanding what the distance means. Arrange set times for children to talk with their friends through video or phone. Let the child lead how short or long to talk. For younger children, it may be useful to keep the times shorter. Use stories to help children understand the importance of hand washing and wearing masks. Some children respond to the idea that superheroes wear masks. They can be a superhero too. Now, let's see how we should take care of a sick family member. Have the person stay in one room, away from other people, including yourself, as much as possible. If it's possible, separate bathrooms. Make sure the person with COVID-19 does the following things. Drinks a lot of fluids to stay hydrated. Rests at home and uses over-the-counter medicine to help with symptoms after talking to their doctor. For most people, symptoms last a few days and they get better after a week. Have their doctor's phone number on hand and call their doctor if the person with COVID-19 gets sicker. If English is your second language, a household member should know how to ask for an interpreter. Look for emergency warning signs for COVID-19. If someone is showing these signs, call 911 immediately. Trouble breathing, consistent pain or pressure in chest, asking weird questions and having new confusion, inability to wake up or stay awake, and bluish lips or face, which is a sign of lack of oxygen. Tell the 911 operator that the patient has or is suspected to have COVID-19. If English is your second language, a household member should know how to ask for an interpreter. In the last part of our video, we're going to see what we should do if the home space is limited. It can be pretty difficult if you have a sick family member or are sick yourself when space in the house is limited. It may not be possible to have a separate bedroom or bathroom for the sick person to use. In these cases, keeping 6 feet or 2 meters between the person who is sick and other household members must happen. Have the sick household member wear a cloth face covering when they are around other people in the home and if they need to go to the doctor. Don't make people wear a mask if they are under 2 years old or are having difficulty breathing. Cover your coughs and sneezes. Wash your hands often and don't touch your eyes, nose, and mouth. Keep people at higher risk separated from anyone who is sick. Have only one person in the household to take care of the person who is sick. This caregiver should be someone who is not at higher risk for severe illness. The caregiver should clean where the sick person has been, as well as their bedding and laundry. The caregiver should minimize contact with other people in the household, especially those who are at higher risk for severe illness. Have a caregiver for the person who is sick and a different caregiver for other members of the household who require help with cleaning, bathing, or other daily tasks. Clean and disinfect surfaces, doorknobs, and other commonly touched surfaces with EPA-registered disinfectants daily. Limit visitors to those with an essential need to be in the home. Don't share personal items like phones, dishes, bedding, or toys. Try to do the following if you need to share a bedroom with someone who is sick. Make sure the room has a good airflow. Open a window, for example, and turn on a fan to bring in fresh air. Place beds at least 6 feet apart, if possible. Sleep head to toe. Put a curtain around or place another physical divider to separate the bed of the person who is sick from other beds. For example, you might use a shower curtain, room screen divider, large cardboard poster board, quilt, or a large bedspread. Have the person who is sick clean and disinfect frequently touched surfaces in a shared bathroom. Washing your hands frequently and properly is very important. It can prevent many diseases including COVID-19. Wet your hands with clean, running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands well under clean, running water. And finally, dry your hands using a clean towel or air dry them. Now, if you're wondering how you should seek help, don't forget there are many ways to get help. First and foremost, contact your family doctor and listen to their recommendations. Sometimes this will involve a recommendation to get tested or a recommend to self-isolate or quarantine. They will provide more instructions for what that means. Contact your caseworker if you're having difficulty accessing your doctor. There are also 2 hotlines. If you're living in St. Louis City area, call 314-657-1499 and they can respond you from 8 a.m. to 10 p.m. If you can't speak English, ask for an interpreter. If you live in St. Louis County area, call 314-614-2660. Press 2, wait, and then ask for an interpreter. If you have any questions or comments about this video, please feel free to comment it for us. While we're not doctors, this is your opportunity to ask your questions. If you don't have the answers, we'll find out and let you know. Thank you so much for watching this video. Please keep an eye for our upcoming videos with different topics such as healthy relationships and governmental benefits. Please let us know if there are other topics you'd like to hear about.